Okay guys, hi, how you doing today? This is the second video, part 2 of the runner's injury series. Last time we spoke about runner's knee, patellofemoral pain, pain behind the kneecap. Alright, today we're going to quickly mention a couple of things about what we said about runner's knee and patellofemoral pain. A quick little tip that we forgot to mention, and then we're going to talk about mostly about Achilles Tendonitis and Plantar Fasciitis. Alright, stay tuned guys. Okay guys, we're back. Alright, so first we're going to mention about the Patellofemoral Syndrome, runner's pain. Just a quick fix that you can add to the stretches that we mentioned in the first video. Go back and watch that video. It's going to give you some pointers on how to stretch the quad muscle that's involved in the patellofemoral knee pain. Okay, but what you can also do fast is that you can take a device. Okay, I'm going to take this little device that I use for my table, but it has some edges. You can be rounded, it doesn't matter. You can use your the thing that you wash yourself with, the brush. You can just take it apart and just use the thin brush surface. Okay, but essentially what you're going to do is you're going to bring your knee to a level here, and you're just going to find the area where, palpate the area where the pain hurts anywhere, and you're just gonna start stripping it. You can put a little lotion on, and you're just gonna start stripping it. Okay, from the kneecap on, Okay, and if you find the spot that hurts the most, you're just gonna create some, like right there on this side. I feel a little tenderness, so I'm just gonna stay here a little bit and just create a little deep friction motion like that. Okay, look, a little. This can be done with any brush, like a long brush. You can buy a brush that you wash your back with. Okay, so the long handle of that brush can be used for this purpose. So you're just finding the place and you're just working out all of the kinks right off the patella. Right here is where I feel the most. This is actually the lateral side of the vastus lateralis. So I'm working this, and then as I start to dig in a little bit deeper, they start to come out, all these points. Okay, so this is what you can do to fix that up, to add this little thing to the fix of the quads. Today we're going to talk about Achilles tendonitis and plantar fasciitis. Now these things are two different things, but they're completely related. So what we're talking about is Achilles tendonitis is an inflammation of the Achilles tendon, and where it happens is that it happens in this area, in the bottom portion of the Achilles tendonitis is this tendon right here. It's connected right to the bottom of your heel, right into the heel bone. Okay. Now obviously the Achilles tendon is attached to the calf muscles. The calf muscles are comprised of the gastroc and the soleus. Gastroc has two heads, and it's connected to two joints. It's connected to the knee joint, the gastroc is, and to the ankle joint through the Achilles tendonitis. So it's a malleolar. It's a two joint muscle. Soleus is only connected to the bone and to the through the Achilles tendon to the ankle. Okay, so what happens? There's inflammation, there's pain right here in the back of this Achilles, and it's preventing you from run. The pain is all the way at the bottom. So this is the Achilles tendon being inflamed and being painful. Now, a couple of things that can be happening. One, tightness in the gastroc and the soleus, two different muscles, stretches, two different stretches for these muscles. Okay. Trigger point work can be done on it. We can use a roller, okay, to lay down and roll the gastroc and soleus out together. We can stretch the gastroc and soleus. We're gonna go into those stretches in a little bit later in the next video. Or what nobody really talks about, the problem can be in the anterior tibialis, which is the muscle in front here. So now what's going on is that if this muscle is weak, and it is weak in a lot of people and people don't realize it, the anterior tibialis muscle is weak. So that means that these muscles in the back are gonna be overworking. They're gonna be compensating. So this is the problem, is that these muscles are compensating, they're getting tight, they're getting strong, they're pulling on the Achilles tendon from the bottom, and that's why you're having pain there. So an easy fix is that fixing this, taking a look at your anterior tibialis muscle, seeing, you have to test it You can look at yourself if it's developed or not, okay, and do an exercise to increase anterior tibialis strength. So one of the exercises that can be done for that is heel walking. So you just get on your heels and you do short little steps like this on your heels, okay, and you walk back and forth for about, you pick a distance 5 to 10 feet and you walk back and forth on your heels, and that's one of the things that you can do to strengthen your anterior tibialis. That will also strengthen at the same time some of your calf and your gastroc muscle, okay. So the imbalances is definitely could be causing a problem in this posterior compartment, the Achilles tendonitis, okay. This imbalance can be causing it. The next thing is that there can be tightness in the hamstring. So the tightness in the hamstring is basically also can be causing the problem in the lower leg. The gastroc and the soleus are affected by the hamstring. How, you will say? What happens is that if there's tightness in the hamstring, then what happens is that the knee doesn't extend all the way down. It doesn't extend all the way down. So if there's the knee, that means that it's always having to be in this position here. Now, if the hamstring is tight and the knee doesn't extend all the way down like it should, there's no normal range of motion during running, okay? So now that will create an overworking, again, of the gastroc muscles, which are the two heads of the gastroc and the soleus, okay? This will create an overtension in here. So again, going back to that hamstring, stretching that hamstring, but at the same time strengthening the hamstring. So the health of a muscle is not that it just has to be stretched all the time so it feels flexible. It also has to be able to function well. So definitely we want to take a look at your overall extension. Do you have good extension here? Do you have good flexibility in the hamstring? But also, is the hamstring functioning correctly? Is it strong enough? Is it providing the proper motion and proper stability for the knee joint, okay? Because otherwise, if it's not providing proper stability for the knee joint here, then the gastroc and the soleus muscle will compensate for that stability in the knee muscle, and they will be overworked, overtired, and then they're gonna create a pull on the Achilles tendon, inflaming it and giving you pain. So the next thing we're going to talk about today is plantar fasciitis. Plantar fasciitis is pain in here. Usually it starts from the heel and then it just fans out, because plantar fascia, what plantar fascia is basically, plantar fascia is a tissue. It's mostly a ligamentous type of tissue that comes from here and then spreads out all the way out into all of the fingers this way, okay? So now that's the plantar fascia. Now what happens, obviously, we have the Achilles tendon coming in here, connecting to the heel bone in the back. Now from that same heel bone is we have the plantar fascia fanning out into all of the fingers here. Now flat feet will definitely contribute to some of the pain here, because if there is no arch, there's not enough support in this arch while you're running. But what happens is that, so the Achilles tendon is pulling it from the back, pulling it on top, and then you get the plantar fascia. So the Achilles tendon inflammation or problems with the gastroc or problems with the hamstring muscles can be also causing problems with the plantar fascia. So you can be having pain in the foot, and yes, there's pain there, and yes, we need to work on that pain in the foot, by rolling it out, doing some trigger point work on it, doing different maneuvers to the foot, range of motion to the foot and things like that, icing it, okay? But the problem can be coming from the tight hamstring, from the overworked gastroc and soleus, from the imbalance in the anterior tibialis. So we need to take a look at all those things. You need to evaluate yourself. If you can evaluate yourself, you can come to a professional like myself, and I will be able to evaluate where the problem is in your muscles, and then we'll be able to correct it. We will do rehabilitative exercises correctly to strengthen the hamstring, relax the soleus, increase strength in the anterior tibialis muscle, okay? So these are two problems, the Achilles tendonitis and the plantar fasciitis, that are completely tied together, because it's a whole complex, because the hip, the knee, and the ankle and the foot is a one chain, okay? It's a chain that starts from the ground up, with the heel being, you know, heel strike hitting the floor, the knee having some rotational movement and stability there, you know, the hip having to rotate externally and internally. So it's a chain. So when we're talking about plantar fasciitis, we need to talk about the whole foot chain, the whole leg chain, okay? So that's what you need to figure out. If you're having pain in the foot, in the calf, in the knee, or in the hip, there can be a problem somewhere else, and that's what you need to take a look at. You know, we need to work on that ITP band, we need to work on the adductors, see if the adductors, a lot of times what happens is the weakness in the adductor compartment, which is the muscles here on the inside of our, you know, the hip muscles, okay? Now these muscles are the ones who are responsible for the medial knee stability, okay? If there's no medial knee stability, then there's weakness, and then the muscles are not functioning correctly, okay? So this is what's going on. You know, there's a lot of things happening between your ankle and your hip area, okay? And if you guys are running, you need those quick fixes. And the whole idea behind everything here is that, you know, you can do this on yourself, and you can try, and there's a lot of things that you can actually fix and tweak by yourself. But the reason that I'm here is that, you know, you can guys always jump into my office and come in, and we can take a look at you, we can see what's going on, decipher all of these things that are happening to you, and then we can just basically fix you up. And then you can go, my motto is that I want you to be out there running, I want you out there getting fit, and leave all that fixing up to me, you know, and I can teach you, and I want to teach you, and I want to be able to, so you can tweak, do little things by yourself, okay? But when the major things happen, you can come in and you can just, you know, fix you up, and you can just go right out there. Okay guys, thank you very much, have a great day today.